Welcome friends! I'm Dr. Rajsree Nambudripad. I'm board certified in internal medicine, and today's video is all about my herbal protocol for SIBO. SIBO stands for Small Intestine Bacterial Overgrowth, and I have a whole video dedicated to SIBO, which I'll link below, and I definitely recommend that you watch that video as well to get a full understanding of the condition. I get inquiries from people every day who are looking for guidance on how best to implement the herbal protocol to get rid of their SIBO. And there's so many questions on the SIBO diet. So that's what inspired me to make today's video. Over the years, I've treated hundreds of patients in my practice with SIBO. And that's what's allowed me to develop this very effective herbal protocol. So today, not only am I going to present the key supplements and how best to take them, I'm also going to review the diet and lifestyle changes you need to make to successfully get rid of your SIBO. And I've broken down the protocol into 4 phases. The reason for the 4 phases is I wanted to make the protocol very easy for anyone to follow. And by spreading it out into 4 phases, it's a very gradual and gentle approach, and we're reducing the risk of running into side effects. One of the reasons I've done so much research on SIBO is that years ago, I actually personally suffered from SIBO. And the protocol I'm going to present today is the very protocol I use to get rid of my own SIBO. But first, let's quickly review what is SIBO. SIBO stands for Small Intestine Bacterial Overgrowth. So normally, your small intestine does not have a lot of bacteria. Most of the bacteria is located in your colon or large intestine. But if something causes the bacteria to back up from the colon into the small intestine, this is called SIBO, and it can cause a wide range of symptoms. One of the most common symptoms of SIBO is bloating. In fact, people with SIBO feel bloated after every meal, and they often tell me they look 6 months pregnant after eating. SIBO can also cause symptoms of irritable bowel syndrome, or IBS. In fact, SIBO is the root cause of over 70% of IBS. The small intestine is really not designed to have gas in it, so when gas stretches the smooth muscle wall of the small intestine, it can cause a significant amount of pain and discomfort. SIBO can also alter your bowel habits. So there's 2 main kinds of SIBO. So hydrogen SIBO is associated with IBS with diarrhea, and methane SIBO is associated with IBS with constipation. Now, the official terminology for methane SIBO has actually changed to intestinal methanogen overgrowth. But for ease, I'm going to be referring to it as methane SIBO throughout this video. People with SIBO become sensitive to a lot of foods. For example, they become afraid to eat certain foods like fruit or bread because it causes them so much bloating and abdominal discomfort. SIBO can also cause systemic symptoms like anxiety, brain fog, fatigue, and even joint pain. What's interesting is a lot of people with IBS undergo a lot of tests that all come back negative. For example, they may undergo an upper endoscopy, a colonoscopy, an abdominal ultrasound, maybe even a CT scan, but they don't find anything. That's because these patients often have SIBO, but it's often overlooked. So if you're suffering from any of these symptoms, it's a good idea to get a SIBO test. The way to diagnose SIBO is with a Lactulose breath test. This is a test where you drink a solution of lactulose, which is a type of sugar your body can't absorb, but it'll stay in your small intestine, and the SIBO bacteria will turn it into gas. So then you collect your breath every 20 minutes for a 3-hour period. This is what a positive test looks like. As you can see, a rise in hydrogen of over 20 parts per million in the first 90 minutes, or any methane level over 10 parts per million at any time during the test is considered positive for SIBO. This is an example of severe methane SIBO. As you can see, the methane levels are over 81 parts per million pretty much throughout the test. So how can you get a SIBO test? Well, you could ask your gastroenterologist, or you can work with a functional medicine provider who's knowledgeable in SIBO. You can also self-order a test from various companies online. Quick disclaimer. Although today I'm going to be presenting my herbal protocol for SIBO, I do recommend that you work with a healthcare provider who can best interpret your tests and give you more personalized guidance on the SIBO treatment. Unfortunately, not all providers are knowledgeable in treating SIBO with herbs. So that's why I wanted to make this video to have this information available and accessible to anyone. And everything for the protocol is available on my online store, which I'll link below, and we ship throughout the United States. Unfortunately, if you're pregnant or nursing, you can't follow the herbal protocol. But you can still implement some of the diet tips I'm going to talk about today, and that may help improve your symptoms. Now, why should you choose an herbal protocol? Why not just take antibiotics for SIBO? Well, there was a study published from Johns Hopkins University that showed that herbal antimicrobials are equivalent to antibiotics in treating SIBO. The other thing to keep in mind is that antibiotics don't always work for SIBO. That's because they kill the SIBO bacteria, but they don't always address the root cause of SIBO. So treating SIBO is a bit more nuanced, and simply taking antibiotics doesn't always work, or it comes right back. The herbal protocol, in my opinion, is superior to antibiotics for a couple reasons. First, the herbs work not just for SIBO, but they work for other conditions as well. So they also treat SIFO, which is small intestine fungal overgrowth. They work for Candida overgrowth, which is a type of yeast. And they also work for dysbiosis, which is a bacterial overgrowth. And what's interesting is a lot of these conditions coexist. So for example, most people with SIBO also have dysbiosis in their colon. Now, if you'd like to learn more about Candida and SIFO, I have a whole video on that, which I'll link below. The other advantage of the herbs is they have a lot of anti-inflammatory benefits and immune boosting benefits. In order for SIBO treatment to be successful, we have to address the root cause. And generally, there's two main big root causes of SIBO. The first is sluggish motility in the small intestine. So this means your small intestine is not having the normal waves of peristalsis to sweep food and bacteria into the colon. The second root cause is problems digesting food due to low digestive enzymes or low stomach acid. This allows bacteria to overpopulate in the small intestine. So we need to address all of this when we treat SIBO. SIBO treatment has three fundamental parts. We need to kill the bacteria, starve the bacteria, and promote motility. And I've broken this down into 4 phases. My goal in spacing out the phases is to help reduce side effects. And it allows you to try the protocol very gradually and figure out how each of the phases affect you. The phases are designed to address the root causes of SIBO, which is key to a successful SIBO treatment. So you start with phase 1, and after a week, you add in phase 2. After another week, you add in phase 3, and finally, you'll add in phase 4. Let's go over phase 1 of the treatment, which is to promote motility. And we're going to do this with magnesium, motility activator, and meal spacing. Magnesium is going to help move your bowels. So it works as a natural osmotic laxative. So it just pulls water into your colon. So we use essential magnesium, which is a chelated magnesium, which has magnesium citrate, malate, and glycinate. So you start with 2 capsules at bedtime, and your goal is to have a nice and complete bowel movement every day. If needed, you can gradually increase the dose up to 4 capsules at bedtime. The nice thing is most people are deficient in magnesium, so it also helps their sleep quality, it helps with muscle recovery, and it even helps with anxiety. Now, if you're having diarrhea multiple times a day, then you can skip the magnesium. Motility in the small intestine and motility in the colon are 2 separate things. For example, there's some people who have multiple bowel movements a day, but they still have sluggish motility in their small intestine. So let's talk more about motility in the small intestine. So we have an enteric nervous system, which are the nerves in the lining of our intestines, and they create these waves of peristalsis called the migrating motor complex. These are critical waves that sweep food and bacteria from your small intestine into your colon. Often in SIBO, the migrating motor complex has been damaged due to some underlying root cause. For example, it could be food poisoning, autoimmune disease, or even stress. Another common problem is that some people are snacking throughout the day. So this doesn't give your migrating motor complex a chance to clean out the small intestine. This is where we can use motility activator. So this is a patented formula of ginger that helps to promote those waves of peristalsis in your small intestine. So it's a natural prokinetic. So you take 1 capsule at bedtime along with your magnesium. Now I want to point out that motility activator is not a laxative. So even someone with diarrhea can take it. It just helps to promote those healthy waves of peristalsis throughout your small intestine. So by taking it at bedtime, you're helping to promote your migrating motor complex to help it sweep out your small intestine all night long. That way you wake up feeling a lot less bloated. Now, what if you still have constipation despite taking magnesium and motility activator? Remember, some people with methane SIBO suffer from severe constipation. Well, that's when there's an optional add-on for phase 1. And this is when you can add Aloe Pro. So these are the dried leaves of the aloe vera plant in capsule form. So you take 1 capsule at bedtime along with the magnesium and motility activator. So Aloe Pro works as a natural stimulant laxative. Another big part of phase 1 is to stop snacking between meals. We call this meal spacing. So you want to have 4 to 5 hours between your meals and at least 12 hours between dinner and breakfast. Now, if you're able to do intermittent fasting and go longer periods of time without eating, like 16 to 18 hours, that's even better. So the reason meal spacing is so important in SIBO is it gives your migrating motor complex the time it needs to sweep out your small intestine. So this concludes phase 1. So once again, phase 1 is promoting motility with magnesium, motility activator, and meal spacing. After a week of doing phase 1, you can add in phase 2. Moving on to phase 2. In phase 2, our goal is to reduce your gas levels, and this is going to really help improve your bloating and discomfort. And we're going to do this by adding digestive enzymes and starting the SIBO diet. SIBO bacteria, they feed off of the food that's not properly broken down in your small intestine. By taking digestive enzymes, you're going to digest your food better, and you're going to have a lot less gas and bloating. Digestive Enzyme Pro is a strong and effective broad-spectrum enzyme. So it has ox bile and pancreatin to digest fats. It has bromelain from pineapple and papain from papaya to digest carbohydrates. And it has betaine and pepsin to digest proteins. So you want to take 1 to 2 capsules either before or after your meals. Some people prefer to take it in advance of the meal, so 5 to 30 minutes before they eat, while others prefer to take it after the meal. So either way is fine. I recommend that you try it both ways to see which works best for you. Now there's an optional add-on for phase 2, and it's called betaine and pepsin. One of the common root causes of SIBO is low stomach acid, also known as achlorhydria. A clue that you might have this problem is if you have a lot of burping and belching after meals. So betaine is hydrochloric acid and pepsin is the enzyme that digests proteins. So you take 1 capsule after the meal. Now, how do you know if you need betaine and pepsin? Well, if you take it after your meal and you don't feel anything, meaning you don't experience any burning, that means you need it. You weren't making enough stomach acid on your own. But if you take it and you notice some burning, that means you don't need it. You're already making enough acid on your own. Now, if you experience the burning, don't be alarmed. You can just eat a little bit more food to neutralize the acid, or you can put a 1/4 teaspoon of baking soda in a glass of water and drink that to neutralize the acid. For people who have low stomach acid, taking betaine and pepsin can be a game changer in their digestion. Now, the second part of phase 2 is to start the SIBO diet. So what is the SIBO diet? The purpose of the diet is to eliminate the foods that are feeding the SIBO bacteria and also to eliminate foods that are common triggers for abdominal pain. First and foremost, you need to eliminate all sugar, artificial sugar, and alcohol. The diet I recommend is a low FODMAP diet combined with a low lectin diet. So you need to avoid foods that are high in FODMAPs and foods that are high in lectins. So what's a FODMAP? FODMAP stands for fermentable oligodimonosaccharides and polyols. Basically, it's a measure of how likely a food is to be fermented by the SIBO bacteria into gas. Some of the high FODMAP foods that you're going to need to avoid during the SIBO diet include beans, dairy products, and whole grains. So this includes breads, pastas, cereals, even oatmeal and quinoa. You also need to avoid garlic and onions, which are high in FODMAPs. But the good news is you can use them to flavor your oil. So for example, you can put a large clove of garlic in the oil and a large piece of onion, but just be sure to remove it from the oil. Now, what about vegetables? So certain vegetables like asparagus and artichoke are high in FODMAP, so you have to avoid those. I recommend that you use the Monash University FODMAP app so you can look up any vegetable and know which ones are safe during the SIBO diet. I also recommend avoiding vegetables that are high in lectins. So what are lectins? Lectins are the outer coating of beans, whole grains, seeds, and seeded vegetables, and they can be hard for the gut to break down. And for some people, they can cause abdominal pain and discomfort, especially for those suffering from IBS. Examples of foods high in lectins include tomatoes, bell peppers, eggplant, zucchini, and cucumbers. Now, what about fruit? So fruit all have a type of sugar called fructose, which can feed the SIBO bacteria. So if possible, I recommend that you avoid all fruit during the SIBO treatment. One exception is if you're really underweight or if this diet is just too difficult for you, then you can include low FODMAP fruit. Just be sure to use the app to look up which fruit are low in FODMAPs. Now, what about proteins? Well, all the non-vegetarian proteins like chicken, fish, eggs, turkey, shrimp, and beef are fine during SIBO treatment. And this is because they have no fiber to feed the SIBO bacteria. Vegetarian proteins like lentils and beans are a bit more problematic in SIBO. That's because they have resistant starches, so they break down slowly in the small intestine. If you are vegetarian, use the Monash app to look up options that are acceptable, and they also give suggested portion sizes. Now, what are some carbs that are okay during the SIBO treatment? Well, carrots, sweet potatoes, yams, and white basmati rice are fine. White basmati rice is the only grain that's okay during SIBO treatment, and that's because it has no lectins and it breaks down quickly in the small intestine, so there's nothing left to feed the SIBO bacteria. It also has a lower glycemic index compared to other white rice. During SIBO treatment, I highly encourage you to eat a lot of dark leafy greens. So this includes arugula, spinach, chard, and kale. This is because the greens are going to help keep you full, stabilize your blood sugar, and keep your bowel movements regular. Now you can eat them raw in a salad, or you can cook them. If you're eating them in a salad, you want to dress it simply with lemon juice, olive oil, salt, and pepper. In summary, the SIBO diet is very similar to the paleo diet. You also have to avoid garlic, onions, and fruit, and white basmati rice is allowed. One of the nice things about this diet is it's very anti-inflammatory, and people will typically lose 5 to 10 pounds, and they feel so much better on this diet. To keep your diet interesting, you can flavor your food with ginger and fresh herbs like basil, parsley, and mint. You can also use basic spices like turmeric, cinnamon, and Italian seasoning. You do want to avoid spices that are high in lectins, which are cayenne pepper and chili pepper. One thing to keep in mind is that every person with SIBO is unique. So for example, if you're eating white basmati rice and it's worsening your constipation, then you probably shouldn't be eating it. Now, does the diet need to be perfect? Well, do the best you can. Those who have the best outcomes typically are pretty careful with the diet, but I have also seen patients who were less strict with the diet, but they were still able to overcome their SIBO, but they had to treat it for a longer period of time. Once again, Phase 2 of the SIBO protocol is to reduce the gas levels by taking digestive enzymes and starting the SIBO diet. This should have a significant impact at reducing your bloating and abdominal discomfort. After 1 week of doing Phase 2, you can add in Phase 3. Phase 3 of the protocol is to reduce inflammation. So the SIBO bacteria can cause a lot of inflammation in the lining of your small intestine. In fact, most people with SIBO also have leaky gut. And I have a whole video dedicated to leaky gut, which I'll link below. The way we're going to address inflammation is by introducing Spore Probiotic IgG. So the full dose is 3 capsules first thing in the morning on an empty stomach with water. So the IgG part is immunoglobulins. So they're IgG antibodies, and they're dairy-free because they're derived from bovine serum. So the immunoglobulins work to rapidly heal inflammation in the gut. They also help to bind any toxins and food particles that are irritating the lining of the gut. Spore probiotics are a type of bacillus bacteria. Spores are dormant organisms that germinate in your intestines, and they can survive hostile environments like stomach acid. So they can last up to 21 days in your intestines. So they're very effective at gently repopulating your microbiome without overpopulating your small intestine. There was a study published in 2019 that showed that spore-based Bacillus probiotics improve symptoms in SIBO as well as IBS. Once again, phase 3 is to reduce inflammation by introducing spore probiotic IgG. After a week of doing phase 3, you can introduce phase 4. Phase 4 of the protocol is to finally kill the bacteria with the herbal antimicrobials. But the nice thing is, because we've gone through phase 1, 2, and 3, these herbs should now be a lot better tolerated with a lot less side effects. The 3 herbs that we use are berberine pro, oregano oil, and alicidin. Berberine comes from the root of the berberine plant, and it has a lot of anti-inflammatory properties, and it's also known for activating insulin receptors. Oregano oil comes from the Mediterranean herb, and it's in capsule form so that the oil gets released in your small intestines. And alicidin is the antimicrobial part of garlic. Now I know you might be wondering, I thought garlic wasn't allowed during the SIBO treatment. Well, that's because the fiber in the garlic is high FODMAP. But alicidin is just the antimicrobial part of garlic, which we can actually use to kill the SIBO bacteria. Now, which herbs should you choose? Well, this is where it's really helpful to have a SIBO test. Hydrogen SIBO is treated with berberine and oregano. Methane SIBO is treated with all 3 herbs, so berberine, oregano, and alicidin. And if you have both types of SIBO, you also use all 3 herbs. Now, a quick warning. Berberine does interact with blood thinners and certain prescription medications, so it's always good to check with your doctor or pharmacist. Also, if you're pregnant or breastfeeding, you cannot use these herbs. So getting back to the protocol. The way you take these herbs is 1 capsule of each herb after every meal. So for example, if you're treating methane SIBO, you're going to take 1 berberine, 1 oregano, and 1 alicidin after breakfast, lunch, and dinner. Now, when starting these herbs, I recommend that you introduce 1 herb at a time. This gives your body a chance to adjust. For example, you could start with berberine, then 2 to 3 days later, you could add oregano, and then 2 to 3 days later, add the alicidin. So your goal is to work up to taking all the herbs after every meal. Now, if you're doing intermittent fasting, you won't take the herbs when fasting. You only take them after the meals. Now that you're doing phase 4, make sure that you're also doing phases 1, 2, and 3, because they really help improve toleration of the herbs. Hopefully, side effects should be minimal because we've done so much preparation before starting these herbs. So hopefully the treatment should be more pleasant with less symptoms of die-off. Now here are a couple tips. First of all, Digestive Enzyme Pro really improves toleration of the herbs. Not only does it help you break down food, but it also helps you digest the herbs better, so that you're not burping up oregano, for example. The immunoglobulins in the spore probiotic IgG also help to reduce symptoms of die-off, because they bind the bacterial toxins that are being released as we're killing the bacteria. But if you do experience some die-off, symptoms can include fatigue, nausea, headaches, body aches, and loose stools. If you're noticing lower energy during the SIBO treatment, it can also be helpful to take methyl B complex, which is the big energy and stress vitamin, and it can also help to lower anxiety as well. So how long do you take the herbs? So a treatment course is 4 to 6 weeks once you have all the herbs on board. Often it's not until you finish taking the herbs that you really notice the difference in your bowel habits. Now, should you repeat a SIBO test at the end of the treatment? So retesting with the SIBO breath test is optional but encouraged. Here's an example of a negative SIBO test after completing the treatment. As you can see, it's now a flat line with no rise in hydrogen or methane. It's always wonderful to see this with my patients after we finish a SIBO treatment. Now, everyone is different, so I can't guarantee that this protocol will work for you. But in my experience in treating hundreds of patients, this protocol is extremely effective. What's fascinating is it heals not only SIBO, but other symptoms as well. For example, at the end of the treatment, patients will tell me that their bowels are now daily and formed, They have more energy, their brain fog is lifted, their joint pain is gone, they notice their skin has improved, and women will even tell me that their menstrual issues have resolved. The other benefit is a lot of people actually slim down by 5 to 10 pounds. So can you take the herbs longer? The answer is yes. The herbs are generally very safe and well tolerated. So I have treated some more challenging cases of SIBO where I had to have the patient take it for 3 to 6 months to really clear out their SIBO. The other instance is if you're not as strict on the diet, you may need to treat your SIBO a bit longer. Finally, if you repeat that breath test and it shows that your SIBO has improved, but it's not fully gone, that's another case where you want to take the herbs longer to really clear out the SIBO. Once you complete phase 4, this is when you can start reintroducing foods back into your diet. Food reintroduction should be really gradual. I recommend that you start one new food every 3 days so that you can really observe how your body responds. So for example, you could start eating apples again, and then 3 days later, you could try garlic. Now that you've finished treating SIBO, congratulations, you're probably feeling so much better, but you're still not out of the woods. I want to emphasize the importance of continuing certain things to prevent a relapse, because more than half of SIBO patients encounter a relapse at some point. So I encourage you to continue meal spacing. This means no snacking between meals. And you may also want to continue the digestive enzymes, as well as the bedtime magnesium and motility activator. You may also want to consider introducing a more broad spectrum probiotic, like our Probiotic 100 Billion, which has over 5 strains of Lactobacillus and Bifidobacterium, which are the good bacteria to help protect your microbiome. The good news is if you ever encounter a flare-up of your SIBO, you can always repeat this protocol anytime. Once again, here's a summary of my 4-phase protocol for SIBO. As we've talked about today, SIBO is a big root cause of IBS, but the good news is it's a very treatable condition. By breaking down the protocol into 4 phases, hopefully you'll have less side effects and a more successful outcome. Please post all your questions and comments below. I really look forward to hearing from you. Once again, you can find all the products for this protocol on my online store, and we ship throughout the United States. Thanks so much for watching this video. If you enjoyed it, please give it a thumbs up and subscribe to my channel. I hope you have a wonderful day, and I'll see you next time.